maybe we start with this. So many women will ask, why is my libido, my sex drive low? And so what's really going on here? Could you explain that to us?
Yeah, and it's so complicated. I think that libido is complicated. I think there's not a linear route from like desire to orgasm as it was once thought for. That's a male model. With the Masters and Johnsons, where you go from desire, arousal to orgasm to
Hmm.
post-orgasm state. But I feel like it's very complicated for women, especially midlife women, because we have a lot going on. So I say, like I talk to my patients, I would tell them that, our brain is our biggest sexual organ, right? And
Right.
sexual dysfunction, it is the most common complaint, which is low libido with bother, right? Like I'm bothered. I want to have sex and I can't. And so that's
Hmm.
called hypoactive sexual desire disorder. And it is the most common sexual complaint in midlife, upwards of 40%, some even higher if you look at other surveys of just, people complaining of low libido. But what tends to happen is, again, your brain is your biggest sexual organ. You think about what are the things, I would say we talk about excitation and inhibition when it comes to sexual response, right? Because it's a sexual tipping point. What brings you
Right.
into an excitatory mode, what brings you to an inhibitory mode. So I like to say it's like the let's go versus, hell no. Like, where are you at, right? Like, what's your
Right.
let's go? What your let's go is like, from a biologic perspective, it's testosterone, right? It's a big mediator of sexual function. There's oxytocin, which is another hormone that mediates sexual function. And then you have these neurotransmitters that are so important, your dopamine, your norepinephrine. And then on the opposite scale, you have like the hell no, like that's your serotonin, right? People don't ever realize that when like women enter midlife, they are 4 times as likely to experience like anxiety, depression, all these symptoms and get these SSRIs. But a lot of times
Right.
they don't get told that the sexual side effects from them because serotonin inhibits sexual desire, arousal, and orgasm. And so that's
Hmm.
one thing. And then things like, prolactin, opioids, other things from a biologic perspective. And that's biology, right? That's your brain. But what else is happening? We treat sexual dysfunction in a biopsychosocial lens. So there's psychology behind it, right? Like if you're depressed, and one of the main symptoms of depression is complete anhedonia, lack of desire to
Hmm.
do anything. Sex
Right.
is going to go along with that, right? So if you're
Right.
completely depressed, you're inhibited, and you have no motivation to do anything, that's going to be number one. If you're completely anxious all the time and you're ruminating and you're having these, what I call brain hiccups, you're going on and on thinking one thing after another, like that sex is not going to be part of that rumination usually. So there's like these mental health loads that we carry, which is around, anxiety and depression, which comes when we start having hormonal shifts, right? Because estrogen modulates all of the neurotransmitters that are so important for our mood and our overall quality of life. So depression,
Hmm.
anxiety start to really become into the equation for a lot of perimenopausal women. And then there's
Hmm.
like the social aspect, right? Like you're in a
Sure.
relationship for over 20 years, like and excitement's gone. We know that in heteronormative sexual relationships where the gender roles are pretty classic, right? Male gender roles and female gender roles. There's studies that show that people that are in these heteronormative relationships with women who are having sex with men, like they actually have lower desire related to a lot of household work, right? I always say if like you're the one doing all the dishes every day and you're cleaning up after the kids and you're the one doing the daily grind and the mental load from that, on top
Right.
of the fact that, you might be the one that has to take care of your significant other, like it's a no-brainer that libido goes down in that scenario. You're not motivated. And my patients tell me this all the time. They come home exhausted from work and their
Right.
husband is sitting on the couch and they're looking at them like, oh, I still have to make dinner, take care of my kids,
Right.
go check on my parents, like all the things. Like I don't get that decompression time. So that mental load of
Hmm.
really having to deal with all the social aspects of your life, right? And as
Hmm.
women, we're natural caregivers. So we carry a lot of burden on us. We are in a
Sure.
sandwich generation. We're taking care of kids. We're taking care of parents. We're taking care of our careers if we have them. Like it's
Right.
a lot to juggle. And that becomes sort of the last thing on the equation. So it's biopsychosocial. That's why they always joke, those memes that go around with a man who has no shirt on and he's got a vacuum in one hand and a baby in the other, and he's got an apron on. And they said, this is porn for women. Like it
Right.
is. Like women are, they want that. They want to have like that mental load taken off of them. And so
Right.
there's that. So there's all of these things happening in midlife. Some people are at the pinnacle of their career, right? They're all of a sudden like
Yeah.
doing these great things that they weren't doing before, or kids are out of the house and now they're
Right.
transitioning. And there's so much going on for women in midlife that it becomes almost impossible to want like if you want to have sex, it's like amazing. And then you bring
Right.
into it the menopausal effects, which we can talk about when it
Right.
comes to like your genital urinary symptoms and sexual pain that comes about, that, the
Right.
combination of all of this is
Yeah.
astounding. We always joke
Yeah.
in like the menopause realm that with our, menopause buddies is, that we can give hormone replacement therapy, which is what it's been traditionally called, but we can't do husband replacement therapy. That's on you. So yeah, if you're married to an asshole, that's not going to change, right? Like I think that's something you have to do on your own. But
Yeah.
it's a lot. I think women carry a lot, and this
Yeah.
transition is very difficult. That's such that most women don't feel like themselves. There's other things that happen from a health perspective, right? Like there's your body image that changes. People develop like
Right.
visceral fat, midsection fat from menopause. They might
Mhm.
feel like they're, aging, and like they don't feel good about how they look anymore.
Right.
Some people develop cancers in midlife, and their breasts are so attached to their sexual function. So I feel
Mhm.
like there's a lot into the equation that make
Right.
them, feel like they don't even want it because they don't
Right.
feel good about themselves.
Right. And I mean, I'm exhausted just hearing all the things that you just said that, cause a low libido. I mean, and this is the thing, right? Women feel like they have to do something about it, right? They're
Yeah,
exhausted, they're stressed, all of these things are happening, but yet they feel responsible
right,
completely that like there's something wrong with them, that they have a low sex drive, and they're
right.
not quite maybe taking into consideration all of these things that are happening.
Yeah,
Right. And I feel like that's a narrative in the world too. It's like, oh, why do you have a low sex drive? What's wrong
yeah,
with you?
yeah. And not only that, like I'm not a urologist, but my urology buddies tell me this all the time, like because they take care of both the men and the women for women who have sex with men, is that like
Mhm.
40% of men get erectile dysfunction by age 40, 50% by age 50, and the statistic goes up. And
Right.
so you're then dealing with the fact that like you might not even receive any pleasure, right? You might
Right.
not be able to have like pleasurable encounter, that this is something that you're just like, everyone's doing their to-do list while they're having sex.
Mhm.
And,
Right.
and so I
Right.
feel like, even taking into the equation, like what the issues are with your partner, like what are
Mhm.
they experiencing? Sometimes I have patients whose partners have Peyronie's disease, where they have curvature of the penis, and they're like, it's just uncomfortable. It feels gross, like,
Right.
and then
Right.
those poor guys are shamed. They're never getting their help. And so it's just
Right.
like layers of problems. And
Right. And so from your perspective, with all the patients that you've seen, what would you say are like sort of maybe the top 3 reasons? Because you've told us a lot of reasons that libido
Mhm.
goes down in
Yeah.
midlife. What do you think are sort of the top 3 reasons that libido goes down, and what could someone do about it?
So I think there's issues that come about with like sleep and energy, right? So like I think that's a big problem in midlife, right? As our hormones start to shift, as we get up in the middle of the night to pee, as we have ruminating thoughts that keep us up,
Mhm.
as we're attached to our technology and we're just
Right.
doom scrolling all night. I feel
Right.
like women don't sleep enough, and then when you're not sleeping enough, you have a cascade of things happen, right? So I do
Sure.
think sleep is a major factor. I think the hormone dysregulation, like as we get hit into menopause, I always say when your ovaries are retiring, they kind of go out with a bang, because you have, we can go through the basic definition of menopause if that will be helpful. But I do think menopause and perimenopause and the hormonal shifts are really big. And then
Mhm.
I think, some of these issues around stress and the longevity of a relationship, and the lack of spontaneity, and the lack of sort of this spontaneous desire. Those
Mhm.
areas, I think, are 3 areas that I always try to get my patients to work on, right? Around
Mhm.
stress, around sleep, around hormones, and then some
Mhm.
lifestyle modifications. I feel like those are the areas we can attack. But I think it's
Right.
worth mentioning some things about menopause and how that impacts
Yeah,
issues.
no, let's go there. So like what would you say, well, maybe we can start with the definition of, menopause and sort of how this plays into, sexual health and such sexual wellness.
Yeah. So, menopause we define very poorly as 12 months without a menstrual cycle. And so,
Mhm.
it's kind of this diagnosis that comes about retrospectively. And the average age of menopause for most women is 51 and a half in North America. For Black women, it's earlier. For Latina women, it's earlier. For South Asian women, it's earlier. So, meaning that when your ovaries finally retire and you're now in an estrogen deprived state, it really can impact you from head to toe because we have receptors for estrogen from head to toe. So for some women, like South Asian, we're both South Asian, average age, depending on the study you read, is between 47 and 49.
Right.
And then actually there was a recent study that came out that looked at sort of the Masala study, which, was the study around cardiovascular risk for South Asians. Because as South Asians, as you always, and talk about, is that, we are like 25% of the world population, but 60% of the world heart disease or something like that. Right. And so they looked at the women in that study, and a third of South Asian women went through premature menopause less than age 45. So that's pretty pronounced, right? Like to lose that estrogen that early, that affects you from head to toe. So what happens to women is, if you think about the brain, what happens cognitively, people get distressed around cognition. They think they're getting dementia because they have brain fog. They can't think of the next, why did I come in the room? I don't remember. They get ruminating thoughts, anxiety, depression. And it's really depending on how sensitive you are to hormonal shifts, right? Because in your 40s, your progesterone kind of just like baseline decreases. But the estrogen becomes very erratic, as we're losing our eggs, because you're born with every egg you'll have, right? And they just exponentially start to decrease in your 40s. And eventually, your estrogen is responsible for making your eggs. And so if you're not getting a consistent amount to have that normal cycle, there's months that people have very low estrogen. And so they have symptoms of low estrogen, but the next month you might have estrogens in the thousands. And so you get symptoms of high estrogen. And so it's the delta from high to low because your brain is confused. It's sending signals to your ovaries. You're trying to get the estrogen out of the ovaries, and there's not there 1 month. You might have too much the next month because you super ovulate. And so we have these loop cycles, which are the luteal out of phase cycles. And so people have a lot of distress from really the hormonal sensitization of the ups and downs of what's happening with them from an estrogen perspective.